I know a lot of you had questions about dry needling when I posted my video to stories last week. I've been seeing Dr. Brian Mann for a shoulder, I don't know what to call it, injury. But this is a trusted person who I've seen for like 6 years now. So just to be clear, I wouldn't just go to anyone, but we're going to address what needling is and like how it works. It works really well for my body.
Obviously, TJ Watt's like the hot item right now this week. So you do run a risk of, when you're dry needling, of puncturing a lung. I don't know the provider that treated him. I know nothing about that, but I'll kind of tell you how I address that. To avoid that, I'll put a needle in the muscle belly, hook up their little like alligator clamps you'll see. That then sends that same electrical stimulation down into the muscle. So your fascia is supposed to be like these nice, beautiful parallel fibers that go together. Sometimes they'll knot up. So kind of like a knot here, and they go back in. You'll see it twitch sometimes. It'll come out, and it'll twitch, and it'll go back in. So it's really quick twitch, and then goes back. That's when you see them twitch sometimes, which you may see on her trap. I'm gonna clean her up, and then we'll put a couple needles in, and we'll chat a little bit more. This upper trap area, just because the TJ Watt story's like the big thing right now. Your lungs, I know you can feel like the bottom of your rib cage where your lungs are. They also go all the way up to here. So that's why if you push down right here on yourself at home, you'll feel something hard right there. That's your first rib. That's protecting your lungs. Probably not gonna hit it if I go straight in with a needle like this, but what we do here to avoid that is I'll grab the muscle belly, this trap, and I'll just pull it up, and then I'm going in with the needle. So I got it lifted away from that rib so I can go into her trap. Oh, and you see a twitch right there like we were talking about. So you can definitely see that twitch. So that means we're in right on that knot, that trigger point.
OMG.
This is called a piston technique, and I'm still holding that muscle up just to reduce the risk of hitting something that we don't want to hit. I'll do that. I'll kind of go in and out with this piston technique a few times until it quits twitching, but this trap starts all the way up here, comes down, and I'm just trying to get these trigger points out of there. So a lot of things on trying to avoid puncturing a lung. I don't let go, for one. Sometimes you can leave these needles in. People move around, all sorts of things with it. It's just not worth the risk if I don't have to. So I'm holding onto the muscle, I take the needle out, and then I let go of the muscle, just to avoid added risk that we have for no reason. So I'll kind of feel around, find a knot, pull the trap up, needle goes in. Same thing, that piston technique. And you get a twitch right there again. So she definitely has some knots in here because she's going through it right now. But we're essentially here without hooking it up to that stem, telling your body, can you come look at this real quick? So it's like little micro trauma down in that muscle belly. So we're trying to tell your body like, hey, can you come give us a little bit of extra attention? Same thing, take the needle out, let go of the muscle. You good?
I'm sweating.
Traps are one that you're kind of, it's like, it's that good hurt.
Yeah.
We do it for headaches. A lot of people carry stress right here. Any shoulder stuff, I kind of go in here. In this trap, you can go all, most of her stuff's kind of out, more lateral out here, but I'll needle all the way up into the trap, up into the neck with this, because it attaches way up there, it comes down to the mid-back. Let's do one more here, Sonia. I don't know the exact area that's twitching again. We're getting a lot of twitches that you don't usually get this many. I don't know the area that he got needled at. Definitely could have been this upper trap for sure. This whole area, there's just different things that we do to avoid that. We're focused on her trap and shoulder. This is like one of those big risk areas that a lot of times people leave needles in. I just don't do it. Oh, there's a good twitch there. So when you see it twitch, that's the muscle just releasing. You can see a little bit right here still. That's that muscle letting go. There we go. You good? Mm-hmm. Okay, I'm gonna put some area on the shoulder. So I'm gonna kind of stay on the muscle belly of this deltoid, teres major, teres minor, hook it up to some stem. I'll show you those little alligator clamps. You'll see your muscle twitch, and then we'll be done. If you've never seen like dry needling or acupuncture needles, they're very thin. These things, so it's stuck in there right now. So these fit inside a normal needle that like takes your blood. So you'll hear it click. That comes off the wall there where it's stuck to. I'll just show you how thin these guys are. This will fit inside a normal needle that takes your blood. There's different sizes and lengths. This is what I'm using for her shoulder. I can put it back in here because I didn't use it, and then I can put it in her shoulder. It's a little tap here into that deltoid. I can twist it a little bit, and that kind of rolls up that fascia to grab it. That way it grabs the needle a little better, and you can feel the muscle kind of latch on. That way we get a little bit more TLC on it. Pretty big knot right here. Sometimes the shoulder will twitch, but not always. You doing good?
Yes.
There was a story I had from another provider I knew. I forget where this was at. Somebody had needled someone. They were seated and they left some needles in the trap, and they went to like take a selfie to like put it on Snapchat or whatever to show someone. And when you move, like they didn't know to tell the patient this, but the needle moves and it punctured their lung. So little precautionary things that we do, like I pull the muscle off there, she's face down, she's not moving, I'm not leaving them in. I can stay with her if I'm going to focus on an area like that. And then if you get dry needled, yeah, like if you notice like, hey, I'm having difficulty breathing later that day, I can't get a full breath, like that's when you would call your provider and see what's going on, because it is a risk. These are the little alligator clamps I'm going to put on here. Look like tiny little jumper cables. No, I cannot hook her up to my good shoulder and put it on her bad shoulder and fix it. This is just electric that's going to go on there. So I got these little alligator teeth. I put it on the metal part of the needle here. So you'll see it clamp on there and stay. I'm doing, it's going to make a cross, so it kind of, it'll go like this, so the current will kind of hit right in the middle of that muscle belly that I'm going for. There's different ways to do it, but that's what I'm doing with her. So little alligator teeth. If I open this guy up, it'll pinch down on the needle, and then I'll show you what happens when we turn on the stim unit. Okay, this is just like electrical stim. There's different ways to set it up, different ways to do it, different times, different frequencies. I got it set up for her right now. I'll be able to control the intensity, and you'll see her muscle twitch. So she'll feel a tingle first. Tell me when you feel that.
Okay, I'm starting to feel it.
Okay, so she's feeling a tingle in there, and you guys see nothing. I'll turn it up a little bit. You'll see it start to twitch. Tell me when it's too much, because I'm going to back off. So I can go super crazy with it, right? Her whole muscle's twitching. What we're doing now is telling the muscle, or telling your brain, hey, can you come look at this muscle? So it's just extra energy and attention going to this area. So a little micro trauma in there, plus we're giving it some stim, so your body's like, hey, let's check this out. And her body responds really well to needles. That's pretty intense. I'm not gonna leave her on there like that for 10 minutes. I just want it to twitch a little bit, but it's just so you guys can see what it looks like. So here, she'll just kind of relax like this for 5-10 minutes on needles. We'll take her off needles, and then we'll do the rest of her treatment.